cookie cutter, zero mistakes, Toyota assembly line procedures do not work when you're taking care of humans.
That's right. But, well, I should say, and it can work. I remember one of my first projects in 98 or 99. I can't remember. That was a long time ago. I remember walking into these ambulatory surgery centers that we were developing. And really, the flow for the patients was really atrocious. And I remember saying, as an industrial engineer looked at this, and God bless them, these two docs looked at me and go, no, we did it all. And I went, okay, we got to rework how the patient gets from the front door, right, into the pre-op bay, into the procedure room or the OR. Like, we got to rework this whole deal because this isn't going to work. And so there are places where efficiency works, but there's a whole bunch to what you just said. And I hope people understand the nuance and the beauty of what you said, which is no one's the same. And we treat every single person as an individual patient.
Yeah. Yes.
Like, no health system is ever going to say what you just said.
With practices, innovation is what can help practices. Because,
yes,
I'll give you medical scribes and AI scribes, right?
Yeah.
You know how many products there are out there?
A lot.
A lot. One is better than the other, and it's a computer guy that's giving you all these bells and whistles and many bells and whistles. When the doctor just wants something to write a progress note so we can move on.
Yeah.
It writes a good progress note. And it's not the most expensive one is the one that you need, but at a healthcare system level, the guy that makes a decision on to what product to get is usually a guy that's computer illiterate and not using the product anyway.
Or worse yet, he's very computer illiterate. But no, he's very computer literate. He's very good at computer engineering.
Yes.
But he has no clue. He can't talk to a human being.
Yeah.
He can't. He's a genius. And we know someone like that. I'm not going to call her out on the air, but she's a genius. She can write you code to clean out your database any day. But she's a people person.
But they need someone in the middle to translate.
Yes.
But translate, then know some computer lingo to translate it to people like you. But another thing that happens with practices is, in a practice with a number of people, you can go and find a good product that will work in your organization and turn it on just like that. At a system level, you got to make a meeting to make another 5 follow-up meetings with a bunch of people, from nursing to the directors to the whatever, and make no progress.
Well, I think this is one of the biggest challenges. It's really good on some level, but it's one of the biggest challenges when you get large groups together. I'm in a practice, probably 2 practices a week. And one of the big challenges is when we do the partner meetings, there'll be 25 people and the youngest partner will be 36 or something. And the oldest guy's 60. And it's just a battle of, not of wit, but it's like a battle of who's the biggest alpha. And I go in there and I really try to be the neutral party and say, okay, we have this problem and this problem. You guys are scientists. Let's solve these problems and not worry about, like, how much money is it going to cost, or what are the outcomes, or what is this, or what is that. Let's just try to figure out the straightest line we can to solve these challenges. And when you do that, all of a sudden you start seeing some real progress. But I agree with you. It's really tough on a system level to get a bunch of docs to agree on something.
Yeah.
And the health system's got the lawyer, the chief nursing officer. My contract with Epic says that we can't bring that product unless they okay it. And it's just layers and layers. But to our earlier point about Six Sigma, there are places, particularly in the operating rooms, where you can develop Six Sigma, zero errors, which is, there's a hospital that only does hernia repairs in Canada. And everybody uses the same procedure, the same technique to get to the hernia. They use the same sutures, they use the same mesh, and the same protocols. You could do that for knee replacements. You can use the same implant. All the surgeons use the same implant, the same suture technique, the same approach, and the same team does nothing but knee replacements every day.